Hi, today we're going to talk about Chapter 11 from the Unfettered Urologist, and it is about prostate cancer. And most of you who know me well will find that I'm not terribly adamant about too many things, but I have been disturbed by the lack of screening for prostate cancer. So I do want to talk about the high-risk group, or the people who should definitely be screened. If you are of African American descent, or have any African blood, then you are at increased risk for the most virulent forms of prostate cancer. And so your primary care physician should be paying very close attention to your yearly PSA blood test. The other group is if you have had any first-degree family relatives who have had prostate cancer. So if you've had a brother, father, grandfather who has had prostate cancer, then you should definitely be screened. If you are African American and you have had a first-degree relative that has had prostate cancer, then you are in a group of people who should be watched very carefully. If you have a strong family history of breast cancer, if they have found the BRCA1 or BRCA2 gene repetitively in your family, that is actually a risk factor for prostate cancer. If you have a very strong family history of breast cancer, that does increase your risk for prostate cancer. Being over 50 is a risk, and being obese is a risk. Now, a lot of the primary care physicians are telling patients that they don't need a rectal exam, that they don't need a blood test, and I think this is extremely scary. I would go so far as to say that if you are an African American man with a first-degree relative with prostate cancer, that you should probably see a urologist, even if you feel completely normal. I feel strongly about this, and I think that we will find people who need to be treated. Prostate cancer is, for most people, a very treatable disease. But if we don't do any blood testing and if we don't do any rectal exams, then we have no chance of finding it at a stage where we could treat it. So don't just take the word of your primary care doctor, because I believe on this particular subject that a lot of their literature may not be correct. And you have to understand that they're making these recommendations in good faith because they have been concerned that prostate cancer has been overtreated. And I think that is a legitimate concern, but to leave out what is necessary for the high-risk group to be safe, I think is very unfortunate. So read Chapter 11 in the Unfettered Urologist, get more information. And if you're in the high-risk group, consider seeing urology, even if your primary care physician thinks it's not necessary.